The healthcare facilities across the world have become the new battleground thanks to COVID. There should be no doubt that the post-COVID era is going to be very different from the pre-COVID era in terms of healthcare facility operations and management. To understand how the private hospitals are gearing up for post-COVID era, we have Dr. Bharat Gadhavi, Regional Director at HCG Group of Hospitals for Gujarat and Rajasthan. So to start with, Dr. Gadhavi, we'd like to understand from you why private hospitals in India should worry about post-coronavirus care.
So, Corona has actually changed the way things are happening in healthcare facilities. Major impact was on all the non-COVID planned work. So, initially when lockdown happened, there was almost zero planned work specifically related to non-COVID. Surgeries were not being planned, both because there was a panic among the medical fraternity, the doctors, surgeons, as well as the patients. Gradually that changed to having protocols, ensuring that if there is a COVID hospital, ensuring that the staff is completely separated out so that the infection does not happen to non-COVID patients. Protocols were set in to ensure that the staff is also properly scrutinized in terms of infections, etc. All these have helped to now evolve a system wherein the care that is required for non-COVID patients is almost established. The hospitals are now gearing up for getting the non-COVID planned work back on track by managing their own processes, tweaking them differently. And now also there has been a confidence among the people, among the patients. So that work has now gradually started. But post-COVID, they will have to continue the vigil that they were keeping. They will have to continue practicing the safety that they were using. And we also have to understand that COVID is not going to go away immediately after vaccination. So there may be some stray incidences, some stray cases. So all the checks that we were doing, both on staff and the patients, we will have to continue that.
So what we understand that we are going to continue with the protocol what we were following during the COVID. But at the same time, we can see that there is a huge transformation happened in the healthcare facilities during the COVID time. So how COVID-19 has transformed the healthcare facilities? Could we just summarize in that?
So the major transformation that has come in is we all have become quite vigilant about the infection. So everybody is taking all the precautions, wearing gloves, washing hands frequently. Actually, the ICU infection rate in the non-COVID cases have come down drastically because what used to take us a lot of use of training materials, use of some force also to ensure that they wash their hands, that was done automatically without any cajoling or telling them to do it. So the infection rate in ICUs in non-COVID patients have come down drastically. So that is one change that has automatically happened, which is for good, and we need to ensure that that continues. So overall, the cross-infection rate in the ICUs or hospital-acquired infection rate is going to come down. That is one major change that has happened. Second, the way the consultations are being done. Previously, it was a physical requirement that the patient should have been there in the OPD. That has changed. Most of the consultations are now happening if a specific physical examination is not required. Most of the consultations are done on a virtual manner through either a WhatsApp call or through digital platforms. So that is another change. I don't know whether that is going to continue or not, because the need for seeing the patient definitely will remain. But to some extent it will stay. For minor ailments, etc., it is going to stay, and it is going to be helpful also in terms of the saving of the travel time, in saving the patient's requirement to go to the hospital. All this is going to be continued in say 20 to 30% of the patients.
Right, sir. So, what do you understand again that monitoring patient, especially for the COVID was a very Herculean task, and that was the most difficult task for the medical fraternity. And then the technology came into the picture for the smart monitoring, what we call today. So, how the smart monitoring on the wards has evolved during COVID? If you can just tell us.
Yeah, so smart monitoring has definitely helped specifically in COVID patients, wherein the need for going nearer to the patients has been curtailed. Remote monitoring equipments being used, wherein the patient themselves can do that, and the reporting or the indicators can be seen from outside by a consultant, by a clinician. That has helped in ensuring minimal contact with the patient. Thus, the doctors and the staff can remain away from the patient physically, but still can monitor. Similarly, even when the patients underwent home care, specifically those patients who did not require hospitalization, for them it was a blessing in disguise, wherein various instruments, equipments came in handy, and there were equipments wherein their indicators were directly transmitted to the treating clinician, and he could actually look at the parameters and decide what kind of management has to be done, or he needs hospitalization or not. Will be required in terms of innovation and how we can use methods or the newer technologies like robotics, AI, to help us remain away from the patient physically and yet get all the details that are required to make a decision for the treatment of that patient. So it is constantly evolving. Definitely a step has been taken in that direction. We have some parameters which can be done by a distant monitoring, by smart monitoring, but more needs to be done.
So, as you said that COVID is going to stay, forever with us. So, the kind of protocol what you mentioned, even the using smart monitoring system or the basic hand sanitization of other things, or using the PPE kits, everything. So, is it going to be the new normal for individuals as well as the medical fraternity?
Yes, it is going to be a new normal. We'll have to continue taking all the precautions, because as we have heard that there is a new variant. We don't know whether the vaccine is effective in that variant or not. And some patients have already been found having that variant in India as well. So even when everybody is vaccinated, these variants, these mutations will go on, and COVID will stay in one or the other form. It will take years before it completely disappears from the world. So we will have to continue keeping all those precautions. We'll have to continue the way we have been doing during COVID times, ensuring that we are least exposed to the patients, any patient, and still are able to do the best for the patient.
So, with that, viewers, it's a wrap on today's interactive session. Viewers, thanks for watching Mojo for Industry, India's first mobile journalism platform for industry. Thank you so much, Dr. Bharat Gadhavi, for your time and speaking to Mojo for Industry. Viewers, wish you a happy, prosperous, and healthy New Year 2021. Bye for now.